Now let's look at important definitions that we need to remember in the management of the first episode. That is, the first one is the remission. When do we say the child has a remission? Whenever there is urine albumin is either nil or trace, or the proteinuria is less than 4 mg per meter square per hour, and this is seen for three consecutive early morning specimens. So we will tell that the child has a remission whenever there is urine albumin coming as nil or either trace, or the proteinuria is less than 4 mg per meter square per hour for 3 consecutive early morning specimens. We can say that the child has a relapse. If the urine albumin is either 3 plus or 4 plus, or we can say proteinuria of more than 40 mg per meter square per hour, and this is again taken for 3 consecutive early morning specimens. Okay, and this child should be having been in remission previously, because if he hasn't been in remission, then we can say that he has not been cured the first time also. We can say that the child is in relapse whenever there is urine albumin of 3 plus or 4 plus, or proteinuria is more than 40 mg per meter square per hour for 3 consecutive early morning specimens, and the patient should be in remission previously. So these are the definition for remission and relapse. We have 2 more definitions, that is infrequent relapsers as well as frequent relapsers. Let's see. Infrequent relapsers. These are those patients having less than or equal to 3 relapse in a year. And then we have frequent relapsers. And this is when the patient has more than or equal to 4 episodes in 12 months, or you can just divide it in half, that is more than or equal to 2 episodes in 6 months. This story I am talking about is the relapse. So infrequent relapsers are those patients having less than or equal to 3 relapses in a year, or frequent relapsers are those who have a more than or equal to 4 relapses in 12 months, or more than or equal to 2 in 6 months. So that is the definition of a relapse. Now let's look at the definitions of steroid dependence as well as steroid resistance. The first one is the steroid dependence. What do you mean by steroid dependence? We can say that the child is having steroid dependence whenever 2 consecutive relapses when on alternate steroid or within 14 days of its discontinuation. The child is having 2 consecutive relapses when the patient is on alternate day steroid. And what do we give on alternate day steroid? Yes, we'll give the same on up to 40 mg per meter square per day. So whenever the patient, in this case, look at it, we are giving 60 mg per meter square per day, maximum 60 mg for up to 6 weeks every day. Followed by we are giving 40 mg per meter square per day, maximum of 40 mg as a single morning dose on alternate day. When the patient is taking this single morning dose on alternate day and he is having up to 2 consecutive relapses, then we can say that the patient is steroid dependent. Or we have another definition: within 14 days of its discontinuation. Okay, so this is the definition of steroid dependence. The patient is having more than or equal to 2 consecutive relapses when the patient is on alternate steroid therapy or within 14 days of the steroid discontinuation. When do we say patient is having steroid resistance? We look at the definition of steroid resistance. There is absence of remission despite therapy with daily prednisolone for 4 weeks as well as on alternate day for 4 weeks with 60 mg per meter square per day. Definition is the patient is not having absence of remission of the disease despite therapy with daily prednisolone for 4 weeks and alternate day for 4 weeks with 60 mg per meter square per day. So we are giving the child for 4 weeks with 60 mg per meter square per day every day, followed by alternate day with again 60 mg, and still the patient is not having remission, then we can say that the patient is having steroid resistance. Now let's see how do we manage the relapse. So we learn about management of relapse in a child with nephrotic syndrome up to the first episode of a relapse. So these relapses are usually triggered by minor infections. The child did have a remission, but during minor infections the child can have relapse. So these infections can trigger a relapse in the child. We can grade this relapse into low grade if the child is having 1 to 2 plus proteinuria. Okay, or we can say that is having persistent relapse when the child is having 3 to 4 plus proteinuria. So if the child has relapse, we can grade it into low grade when the child has 1 to 2 plus of proteinuria, as well as we can grade it as 3 to 4 plus proteinuria as persistent. And for this, the treatment is the same treatment, that is the prednisolone 60 mg every day for 6 weeks, followed by 40 mg on alternate days. Then we can shift the patient into long-term alternate day prednisolone. That is long-term alternate day prednisolone. This is following the treatment of relapse. So the child had relapse, you have admitted him, you had given him prednisolone every day for 6 weeks with 60 mg. After the following treatment of the relapse, we can put the patient on long-term alternate day prednisolone. Usually small dose is given on alternate days for up to 9 to 18 months. Small dose is given on alternate days for 9 to 18 months. So this is the management of a relapse. Usually relapse are triggered by minor infections. We can grade it into low grade or persistent. Low grade we can say when the patient has 1 to 2 plus proteinuria, and persistent when the patient has 3 to 4 plus proteinuria. The first initial treatment is the same, that is prednisolone 60 mg per meter square every day for 6 weeks, following which we'll put the patient on long-term alternate day prednisolone therapy. Usually it is given in small doses, given on alternate days for up to 9 to 18 months. We can also use steroid sparing agents as well. So the patient is not responding, we can put him on steroid sparing agents as well. We'll have a separate discussion on the steroid sparing agents in the patients of nephrotic syndrome. So this is the basic thing that you need to know in the management of a first episode of treatment in a patient suffering from nephrotic syndrome in pediatrics. Thank you for watching. If you liked it, do share it and subscribe the channel.